Hello, my name is Carrie. I'm a Texas State nursing student. I'm going to be performing a head-to-toe assessment on you, if that's okay.
Okay.
I'm studying to be a psych nurse practitioner, and so this will be a systematic approach to covering all the areas in the body. Are you warm enough? Are you comfortable? Is there anything you need before we get started?
No.
All right, I'm going to clean my hands. So I'm going to start by palpating the scalp and the cranium to see if you have any lesions or lumps or any discomfort.
Okay.
So when I palpate, do you feel anything that hurts, anything that's uncomfortable?
No.
Have you noticed any lesions on your scalp?
No.
Her hair is nice and distributed, it's soft, there's no signs of any deficiencies. And so I'm going to palpate your frontal sinus.
Okay.
Any tenderness here?
No.
And maxillary? Any tenderness here?
No.
Okay, I'm going to percuss here. Any tenderness?
No.
And what about here?
No.
And on this side?
No.
On this side?
No.
I'm going to palpate your eyelids. Eyelids are fine. Eyelashes are evenly distributed. No signs of deviated septum. I want to test your cranial nerve 1. Can you blow out at each side of the nose? Do you have any smelling difficulty or anything like that? Okay, and I'm going to also test cranial nerve 5. I'm checking for light touch. Can you feel this?
Yes.
All right, and I'm going to see if you can feel if this is light or sharp. Soft. Sharp. Soft. Sharp. Okay. And then, where did my stethoscope? Okay. I'm going to listen to your temporal pulses. Is there any tenderness there?
No.
And then next I'm going to check your eyes with the ophthalmoscope. This is a corneal light reflex. Pupils are equally round and reactive to light and accommodation. I'm looking now to visualize the cornea, the iris, the retina in each eye. Okay. And then I'm going to check for the red light reflex. And the optic disc is visualized. I can see the vessels. Okay. And then I want to also look at the sclera. The sclera is white. Conjunctiva is pink in both eyes. All right, and then I also want to check inside of your mouth. Do you have any cavities, anything like that going on? All right, say ah. Ah. All right, uvula is moves when she says ah. The tonsils are normal size. There's no abnormality noted. Any soreness or anything on your tongue or mouth? Can you stick out your tongue for me? All right, and then can you move it side to side? All right, now I want to check another cranial nerve. Can you raise your eyebrows? Can you smile for me? Puff out your cheeks. Can you put your tongue on each side of your cheek? Very good. And then do you have any popping when you open your mouth?
No.
Okay. And then I want to look at your mucosal on your nose. Pink. Okay, everything looks good there. And now I'm going to check your ears with the otoscope. So for the adult, you pull the peanut up and back and the child down and back. The tympanic membrane is visualized. It's pearly gray, no bulging or deformity. Again, on this ear, the tympanic membrane is visualized. There's no deformity. It's pearly gray. And so I want to also do another eye test on you. So there's a Snellen chart over here. This is cranial nerve 2. Can you read line 2 with your left eye?
C-Z-M-E-P-O.
Okay, and then with your right eye?
C-Z-M-P-E-O.
Very good. And then I want to do the Weber test. This is a hearing vibration test. Can you feel the vibration?
Yes.
All right. And can you feel the vibration on this side?
Yes.
And what about this side?
Yes.
Okay, and then I want to check your cranial nerve 8 to see if you can hear when I whisper. 8,
8,
7,
7,
and then again on this side.
6, 5.
Okay, and so that was good. And so I'm going to check your neck. There's no deviation. I can't palpate the thyroid. That all looks good. Let's see, and then I want to also see if you can swallow. Very good. And then I'm going to check your lymph nodes. These are the preauricular. And then we have the temporal, submandibular, submental. And then back here we have the postauricular, occipital, and then these are the clavicular. There's the ones here, and then we have the posterior ones, and then the nodes here on the neck, the subclavicular. I don't palpate any of those. The skin on her chest is evenly distributed. Tuber is good. Shrug your shoulders for me. This is cranial nerve 11. And so I want to see if you can touch your nose for me. Very good. Very good. Okay, and then the next test I'm going to do is I'm going to have you lie back. Or actually, before you do that, let me listen to your lungs. Lungs sound good. I don't notice any use of accessory muscles. Respirations are good and calm. Now we'll listen to the lungs. And again on this side. I'll listen to the lateral lung fold over here. Okay, that all sounds good. And when I percuss back here, can you feel anything painful in here?
No.
Okay. And then I'm going to have you lie back. So I'm going to listen to your carotid pulses. Listen to your heart sounds. S1 and S2 auscultated. Now I'm going to listen with the bell of my stethoscope. The next time I'm going to look at your abdomen, if you don't mind raising your shirt. Okay, so our stomach is even. There's no signs of pulsations. The umbilicus, there's no signs of herniation. Can you raise your head for me? All right, very good. And so next I'm going to listen. Now I'm going to listen to the aortic, renal, and iliac. Then I'm going to try to palpate your spleen and your liver, so the liver on this side. it's not palpable. And then on this side, can't palpate the spleen. And then I'm going to do some light palpation, any pain or tenderness.
No.
And on this side, and on this side, and then deep,
No.
and on this side,
No.
and then deeper on this side,
No.
and on this side, nope, okay. And then I'm going to look for femoral pulses, and inguinal nodes, pulses +2. And then I'm going to just check all your pulses. I'm going to do the radial, and then the brachial. Any problems with the lymph nodes under your arms, the axillary? And then I'm going to check your pulses here. +2 on each side. I'm going to check the pedal pulses on each side. Alright, you can sit up for me. Okay, so next I'm going to look at your hands. There's no signs of clubbing. Capillary refill is 3 seconds or less. Can you do your hands like this for me? Very good. Resist. Okay. And then can you push against me? And then pull up. Any problems with movement of your arms, flexion and extension? What about subnation, pronation? What about doing it fast? Very good. And can you touch your nose? Each side. Very good. What about any problems with your neck? Can you move your neck up, forward and backward, side to side? Very good. As far as your legs go, do you have any problems with any movement in your legs?
No.
Okay, so push down, pull up, okay, push, and push, okay, pull back, very nice. And have you lie down one more time. Okay, I'm just going to check for extension and flexion.
Okay.
Any pain with movement here?
No.
And one more time. Any pain with movement there?
No.
And then this side. Any pain with movement?
No.
And then this side.
No.
Okay, and so can you take your heel of your leg and run it down your shin on each side? Very good. Very good. And then sit up one more time for it. So I'm going to test your reflexes.
Okay.
So ready go. Very good. And then this side. Okay. And right here. Okay. And then I'm going to also check your pulses here. Okay. Right here. Or not your pulses, I'm sorry, your reflexes. And then I'm going to check your reflexes here. And back here. Very good. And here. And then the Binsky reflex is absent. Okay. And then down here at the legs, can you push and pull one more time? Okay, got that check. And then I'm going to have you stand up. I want to check your spine. So you have any problems with your spine? Any tenderness here?
No.
Nope. All right. And then I'm going to do the Romberg test. Can you face me and close your eyes? Okay, she does good. She's not swaying. And then I want to test your gait. If you can walk away and come back. And then when you come back, will you walk on your heels? And your tiptoes. All right, very good. Do you have any questions about our exam?
No, ma'am.
All right, thank you. I
Thank
enjoy
you.
working with you.
All right.